Hi everyone, how are you? This is Ramin Azarm, owner and operator of Flex to Success Clinical Rehabilitation Services, and I'm ready to do a video on body dysmorphic disorder. As I said from my last video on obsessive compulsive disorder, that I would go through all the different disorders covered under the umbrella of OCD. So the first one on that list is body dysmorphic disorder, also known as BDD, and let's get right into it. So body dysmorphic disorder is defined as a mental illness that is characterized by repeated, intrusive, unwanted thoughts regarding perceived flaws of a person's body image. So the key word in that definition is perceived. So when something's perceived, that doesn't necessarily mean it's true. When something's perceived, it could be true, it could not be true, or it could be a delusion, right? And in this case, 9 times out of 10, or very commonly, the perceived flaw that the individual with BDD is experiencing is not something that others can see. It's not obvious to other people. So, examples of flaws that are very common with this specific disorder is preoccupation with a person's skin. In the DSM-5, it says that skin is one of the most common areas that a person will focus on when they're experiencing or diagnosed with BDD. Now, when it comes to skin, it could be acne, it could be paleness, it could be blemishes on the skin, it could be bruises, it could be wrinkles, it could be lines on the face, lines on the hands, it could be sunburn, like it could be anything, it could be rashes, anything that stands out to somebody about their skin can be a point of focus when it comes to body dysmorphic disorder. So another thing that people might focus on when they have BDD is their hair. Doesn't necessarily have to be the hair on their head. It could be their arm hair, it could be their leg hair, it could be their facial hair, it could be the hair on their genitalia, it could be their chest hair, back hair, any type of hair all throughout the body. There's usually like some type of a hyper focus on that. Whether it being there's too much of the hair, there's not enough of the hair is itchy. Other issues could be thinning of the hair, bald spots or balding of the hair. And usually the person will be very self-abusive to themselves, and they will see the flaw as like really, really, really extreme when it's really not that bad. Sometimes people will see their hair thinning like maybe it's not even really thinning, but to the person, they wish that they had a more full head of hair. So to them, like, because they don't have that full head of hair, like maybe like an afro or like just long hair in general, maybe their hair doesn't grow like that, or maybe they wanted curly hair, they have straight hair, they perceive them as, they perceive themselves as ugly because they don't have the type of hair that they would like. A person will perceive themselves as ugly if their skin is too pale. The person will perceive themselves as ugly if they have too much acne. Now, they might not be ugly. In most cases, they're not ugly at all. It's just the person magnifying the flaw so big that they believe that there's no possible way that they could be attractive to anyone because of this one flaw. So there's extreme insecurity attached to body dysmorphic disorder. And we're going to get into that a little bit later. Other areas that people tend to focus on when it comes to body image is breast size for the women. So 2.5% of women experience body dysmorphic disorder in terms of the whole United States population, and about 2.2% of men experience it. Now, out of that 2.2%, many, many, many men are experiencing a very different form of body dysmorphic disorder that has to do with muscle image. And that is known as muscle dysmorphic disorder. And what that entails is men thinking that they're not big enough, they're not strong enough, their muscles aren't developed enough It involves excessively looking at themselves in the mirror, analyzing and checking their muscles, touching the flawed areas that are perceived. So if a guy thinks that his biceps are too small, he'll be constantly touching his biceps, looking at his biceps in the mirror, analyzing them, specifically working out to focus on that one particular body area. But no matter how much improvement they make in that area, they never seem to be satisfied with that particular muscle group, and they always feel like it falls short of their expectations, and it creates a lot of anxiety and distress for the person. And that's the part that people don't see behind closed doors, is when people have BDD and they go home and they're alone, they're miserable. They're constantly focused on these flaws that they have, perceived flaws that they have, and they don't ever stop thinking about them. In order to get a diagnosis of BDD, you would have to be obsessing about your body image, all the things that we discussed, whether it be your hair, the size and shape of your nose, your skin, other areas that people focus on, breast size, genitalia size for men, and then muscle size and muscle tone, right? In order to get the diagnosis, you would have to be obsessing about those areas for between 3 to 8 hours a day. Think about how much time that is. That's like a full-time job. Imagine you're obsessing 8 hours a day on your body image. There are people out there that are that debilitated by this, that they're spending 8 hours a day, 1/3 of their life focusing on these perceived flaws that they think that they have. And like I said, 9 times out of 10, the flaw isn't as bad as they think it is. They just are hyper-focused on it. And another thing that's very common with BDD is that people will get plastic surgery to try and correct the flaws, and they think that that's going to be the answer to their insecurity or to their illness. This is going to cure my illness and make it go away if I just get plastic surgery and increase the size of my biceps or my pecs or my breasts or my genitalia, right? And 9 times out of 10, what'll happen is you'll get temporary relief for, after you get the plastic surgery done. There'll be a temporary point of time where you get relief from the excessive, repeated, unwanted thoughts and intrusive thoughts regarding the obsessed body parts that you're focused on. And then after that temporary time goes by, which could be anywhere from like a couple weeks to a month, you'll start focusing on another body area that's bothering you. Because that's the nature of the illness. The nature of the illness is that you can't fix yourself from the outside in. You have to fix yourself from the inside out. In other words, there's something going on inside of you that's causing these intrusive thoughts, that's causing these obsessions, that's causing these behaviors of feeling like strong urges to check yourself in the mirror, touch and check the body part that's bothering you, to hyper-focus and to constantly compare yourself to other people. Oh, I wish my pecs were as defined as his pecs. Oh, I wish my breasts were the size of her breasts. Oh, I wish my legs were skinny like her legs. Oh, I wish my ass was smaller. Oh, I wish my head was smaller. Oh, I wish my hair was a little bit more curly and longer. Whatever the case may be, the reason why that's happening is that there's a serotonin issue inside of your body that's causing you to hyper-focus and obsess about things. And if you don't address that internal issue, no matter how much plastic surgery you get, no matter how many trips to the doctor you make, no matter how many people you share this with and talk to about this, it's never, ever, ever going to get better. And in a lot of cases, it might even get worse. So my advice to those out there who are suffering from BDD would be, start with talk therapy, preferably some type of cognitive behavioral therapy. And we talked about how cognitive behavioral therapy works really well with OCD. Well, since this falls under the umbrella of OCD, guess what? Cognitive behavioral therapy is going to work great for every single aspect of every single illness under the umbrella of obsessive compulsive disorder. So this is no different. Cognitive behavioral therapy, along with some prescribed SSRIs. Now, when I say SSRIs, I'm talking about selective serotonin reuptake inhibitors. So what do those do? They inhibit the amount of serotonin that's being secreted throughout the body. So if you have an overproduction of serotonin that's causing these obsessive, compulsive, repeated intrusive thoughts about different perceived flaws that you may think you have, right? Anafranil would be a good one. And all these medications that I'm going to shoot out here, these are medications that have been used in blind studies with people who have been diagnosed with BDD and have shown progressive improvement over time with the frequency of obsessions and the intensity of compulsions. So anafranil has been known to help about 63% of people who are suffering from BDD out of the study that was done. Also Lexapro, citalopram, and fluoxetine, Luvox. Fluoxetine is Prozac. So all those ones that I mentioned, there have been studies done that have shown that these medications can assist with this particular illness, along with talk therapy, really, really well. It can reduce the frequency and intensity of the illness, which would be a godsend for people who are suffering from BDD, because this can be very, very debilitating. As a therapist, when you're addressing somebody that's experiencing BDD, you want to gauge their level of insight. Now, I talked about this a little bit before with OCD and my presentation with that. When I say gauge insight, the DSM-5 categorizes insight as poor, fair, and good, right? So you want to see where the patient falls in that particular paradigm. Do they have good insight? In other words, do they realize that they're obsessing over something that really isn't that big of a deal? Sometimes you have people who have mild BDD where they do spend an excessive amount of time obsessing about certain body parts, but they know deep down inside, even though they have the urge to obsess about it, they have the insight to understand that, okay, my biceps really aren't as bad as I'm making them out to be, but for whatever reason, I have this urge to want to hyper-focus and obsess about this particular area. So I have enough insight to realize that what I'm doing is a bit irrational, but yet I understand that I have the urge to want to do this, and I'm not really sure how to fight it, so I'm looking for tools for coping. That would be like mild insight, right? Or good, that would be good insight, sorry. Fair insight would be sometimes you're aware of the fact that your perceived body image flaws are not true, but then other times you're convinced that you're 100% correct about the flaws that you have. So you're 50-50. And that would be fair insight, where you sometimes have a good understanding that you're just going above and beyond and exaggerating a particular flaw that you think you have. And then other times you're not. And then with poor insight is you're 100% convinced at all times that, your flaw is the flaw, and anyone who can't see that, there must be something wrong with them. That's when you know the person has really poor insight, and the worse insight that you have, the more debilitating and disruptive the disorder is going to be. The more time you're going to spend obsessing, and the more time you're going to spend compulsing regarding intrusive thoughts about your perceived body flaws. So gauging the insight is important because you can see how severe the illness is in the particular patient. If the person has really poor insight, you want to work with them to improve that insight. If they have really poor insight, you want to kind of help them get to fair. If they have fair insight, you want to try and help them get to good insight. If they already have good insight, you want to just kind of encourage that good insight and say, hey, listen, it's great that you have the understanding that this flaw really isn't as bad as you think it is. I think maybe with some medications, we can get you back on the right track and functioning at a really high level in society. And you can, achieve your goals and follow your treatment plan objectives and get to where you want to be if you would just have that little push in the right direction. And that might come from the medication. You can start off slow and build your way up and find out which dose would be good for you. So just to recap, body dysmorphic disorder is repeated hyper focusing on body image flaws. The thoughts that you get regarding specific flaws that you think you have regarding your body image are intrusive, they're repetitive, and they usually happen between 3 to 8 hours per day. Different things that people do when they're experiencing the symptoms of BDD, they're extremely preoccupied with a perceived flaw in appearance, and they're constantly comparing that flaw to others and seeing themselves as worse and everyone else as better when it comes to that particular body image flaw. They have a strong belief that a defect in their appearance makes them ugly or unattractive or deformed even. They have the belief that other people can see their flaws and that their flaws really stand out. And when people are interacting with the patient that's experiencing BDD, the patient really honestly believes that the flaw is the only thing that the person who they're interacting with can see. That's how self-conscious they are about it. The patient will engage in behaviors aimed at fixing or hiding the perceived flaw. We call that camouflaging, or actually the DSM-5 calls that camouflaging, which means if you have bald spots that you think are really noticeable and obvious to everyone, even though they're really not, you'll wear like a hat to try and cover them. You'll think that it's so offensive and disgusting looking to other people that you'll be so ashamed of it, you'll be trying to hide it constantly. You'll be going to the mirrors and checking in the mirrors and adjusting the hat to see if you can block the bald spots. It really gets to be time consuming over time. And sometimes it starts out to be time consuming right from the beginning. It depends on the severity of the illness. So attempting to hide perceived flaws, usually by wearing hats or clothing, using makeup, or styling yourself a certain way to hide the flaw. These are all common things that people do when they feel like there's an aspect of themselves that's just really hideous and ugly looking, and they want to do everything they can to hide that flaw. Constantly comparing yourself to others, we talked about that. Frequently seeking reassurance, so this is one that we didn't really touch on. Somebody with BDD will constantly be looking for reassurance from their friends that their flaws aren't that bad, and it can get really annoying sometimes. You might have that one friend that's constantly flexing in the mirror and what do you think, man? You think my biceps are any bigger? You think my chest muscles got any bigger, man? Check me out. What do you think about my neck? Does my neck look jacked? I need to get a stronger neck. You know what I mean? Sometimes you'll have people like that, and they'll constantly be asking you to examine them and tell them that their flaws are no big deal. It can become really what's a nicer way to put it? It can cause people who are associating with this person to become a little impatient with it and frustrated because they don't understand why the person's hyper-focusing so much on this one particular area, which, somebody who has muscle dysmorphia, they'll think that everyone's looking at their build and analyzing their build and judging them based on their build. This is what goes on inside their head. So to them, they think that's the only thing that people are focusing on. But to the outside person, you're like, I'm not even looking at your build. I don't even care how big or strong your muscles are. I just want to interact with you as a friend. So that's why it could get a little frustrating because you're so not on the same page with the people you're associating with when you suffer from this. So if you have a friend that does this, just try to be understanding with them because they might be really ill. Frequently or having perfectionistic tendencies. So that would tie into like getting cosmetic surgery to try and correct a specific area. I'm not going to be happy until my nose is perfect. It has to be like the perfect size, or every time I look in the mirror, I'm going to be stressed out. So I have to keep getting cosmetic surgery on my nose 500 times in a row until my nose is, until I'm satisfied with it. Now, when I say that, a lot of people might be thinking about Michael Jackson. If I had Michael Jackson as a patient, I would have diagnosed him with body dysmorphic disorder. 1,000%. I never had Michael Jackson as a patient, but from what I could see in the public eye, just going on that, if that was all I had, I would have diagnosed him for sure if he was my patient. 100%. Probably on the first visit. And it would have been an easy diagnosis too, based on the amount of cosmetic surgery he's had and the different things that he's done to himself to try and adjust his skin tone and his nose. And I mean, God bless his soul, I know he's passed away, but that's a clear-cut, classic body dysmorphic disorder case. Seeking cosmetic procedures with little satisfaction, we just talked about that, and avoiding social situations. So yeah, this disorder can get so bad that you actually avoid social functioning. You avoid interacting with other people. So you're so insecure about your perceived flaws, and you're so convinced that the people that you associate with, that's all that they could possibly see, that you actually avoid social situations and you don't want to be around people. That can get really rough if you're a child. If you're a child and you're experiencing body dysmorphic disorder, in other words, under 18 years of age, it's important to note that there's a much, much, much higher chance that you will try to commit suicide if you are diagnosed with body dysmorphic disorder at a younger age, like in other words, as a minor. So that's a red flag. If you know anyone of your friends who's a minor and they're diagnosed with body dysmorphic disorder, that person is at risk for suicidal ideation or suicidal behavior. So I would keep an eye on that person. I would make sure they always had a social outlet. I would make sure that they had suicide hotline numbers. God forbid they are stuck in a rut in terms of hyper-focusing on particular body flaws to the point where they've isolated themselves for weeks and they haven't been around people and they're severely depressed and they might be looking for a way out. It would be good for them to have those resources. It might save their life. So please keep that in mind that, children with this diagnosis, it can get really, 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 really dangerous. I haven't had any kids that have been diagnosed with BDD, but if I did, I would develop a safety plan with them on the first therapy visit. Once I understood that they had the signs and symptoms of BDD, I would immediately develop a safety plan with them because I know that they're at risk for suicide. Especially with, bullying and the different things that happen in schools today where kids kind of pick fun at other kids, and somebody with BDD who's hypersensitive about their flaws, you pick fun of them and bully them about their flaws, they might kill themselves. That's a very real thing. That could happen. So it's very important to keep your eye on kids like that. And that concludes my presentation for today. Thank you guys so much for watching. I hope everybody got something out of it today. If you guys have any questions or comments, please leave them below. And enjoy the rest of your night. Take care, everybody. Bye.